Hello, my name is Laura Mendenhall, and today I will be talking about the epidemiology and effects of the bubonic plague, otherwise known as Yersinia pestis. Warning, if you don't like looking at gross images, close your eyes. Characterized by bodily swellings called buboes and the necrosis, or death of skin tissue, the bubonic plague is one of the most well-known diseases in history. The first pandemic. This was first recorded in the Sasanian and the Byzantine empires around 541 AD. Back then, it was called the Plague of Justinian, and this outbreak resulted in the deaths of around 50 million people. The second pandemic, and this is the one we all know of called the Black Death. This occurred in the late Middle Ages, starting about 1347, and a third of Europe's population was wiped out by this bubonic plague. It originated in Central Asia, spreading through Italy and the rest of Europe by port cities and trading routes by the fleas on the back of rats traveling on those ships. The third pandemic occurred in the mid-19th century and originated in Eastern Asia. This pandemic was spread through port cities to the rest of the world via shipping routes. It hit particularly hard in Chinatown of San Francisco, which I will touch on later. In present day, there are still several small outbreaks occasionally, such as in Los Angeles in 1924 and India in 1994. And there are actually plague rodents habitually present in the southwestern United States. Some basic epidemiology about the bubonic plague. The countries with the most plague cases are Zambia, India, Malawi, Algeria, Peru, Madagascar, and the Democratic Republic of the Congo. However, Sub-Saharan Africa and Madagascar alone accounts for 95% of the world's reported cases. The map you see to the right is the world distribution of the plague reported in 1998. It shows the many countries around the world that have plague rodents and recorded plague cases each year. In the United States, as you can see according to the map, we have both. These cases typically occur in New Mexico, Arizona, Colorado, California, Oregon, and Nevada. The United States has had 1,036 cases recorded between 1900 and 2015, with an average of 9 cases per year. In 2020, there was a case in July in Bayanar, Inner Mongolia. After this case was discovered, officials activated a citywide plague prevention system for the rest of the year. There are several influencers of the bubonic plague, some that have happened before and some that have now happened after. For social, we now have a lot of sanitary precautions put into place to avoid outbreaks of the plague. Since we now know that fleas cause this, we often deflea our pets and use medications to ensure no diseases can spread through this vector. Culturally, historical and fiction novels and movies have been written about the plague, typically having themes of the breakdown of society, self, the cultural and psychological existential confrontation with mortality, among others. One such famous example is Albert Camus's novel, The Plague. The Chinese Exclusion Act, enacted in 1881, prohibited all immigration of Chinese laborers. This was reestablished during the third pandemic when Chinese workers came down with the plague. While this was not the only reason the Exclusion Act was put into place, it affected these people to get the proper help and changes the sanitary conditions that they needed. When the plague first started appearing in Chinatown, the state denied the outbreak and ignored it. Because of this, sanitary conditions continued to worsen and the outbreak spread quickly. There are several social determinants of health as relating to the bubonic plague. For gender, this differs historically throughout the different pandemics. During the first and second plagues, it was sort of a free-for-all. If you got it, regardless of gender, it was a death sentence. However, the third pandemic affected mostly the male Chinese workers of Chinatown who did not get access to healthcare due to systemic racism. Now that any patient who is diagnosed in the United States can get treatment. Historically, the bubonic plague was seen as a dirty disease, or one that only affected the lower income classes. In the second pandemic particularly, it began with sailors and their families, who lived in conditions less than clean and in the so-called peasant areas of Europe. This was pretty common throughout medieval ages, as cholera also was seen as a dirty disease. The Eastern Asian and Chinese population of San Francisco were unproportionately affected by the bubonic plague. This was due to several reasons, including the Chinese Exclusion Act, racism, and poor sanitary conditions. Racism towards Chinese immigrants from the Chinese Exclusion Act was socially accepted during the third pandemic, causing denial of many social rights. This denial ended up killing many plague patients as it is made difficult for the community of Chinatown to seek medical attention. During the second pandemic, many people believed the plague to be God's punishment for sinful ways, as the church lands and buildings were typically unaffected. Because these people believed the plague to be God's doing, Christianity became less popular, and eventually the unified Christian worldview splintered. The affected region is typically dependent on where the patient is from. In poorer countries, there is a higher death rate from plague due to not enough access to healthcare. Some lessons learned from doing the research on the bubonic plague. Fleas cause disease. Seriously, it is so important to keep sanitary conditions in the home and workplace. From doing this research, I have come to the conclusion that the most important thing in a workplace, no matter the work, is the cleanliness aspect. Quarantine. It can save lives. Really. This is a simple fact and one lesson learned from the bubonic plague that we can see come into effect today. During the second pandemic, once people caught on that it was the ships bringing in the disease, they would quarantine the ships docked in the harbor for 2 weeks to ensure there was not plague on the ship. Speaking of our pandemic today, masks. They are not a new thing. In the picture to the left, you can see a depiction of the well-known plague doctor mask, typically filled with garlic and other herbs and spices to keep the miasma away. Although unclean air is not the cause of plague, wearing masks helps save the lives of those doctors, as it will help us today save the lives of many people. And another thing I learned is that the plague is really cool, and I really like learning about it and talking about it. This is me, a student excited to become a healthcare provider, hopefully a surgeon. This was me when I was shadowing several doctors up in New York in the Mount Sinai hospital chain. I was watching the cardiac catheter unit, watching people put stents into people's arteries. Reading a lot of this had me a little sad for several reasons. The third pandemic, along with the Chinese Exclusion Act, was a dark time in US history. I truly believe that healthcare is a right, not a privilege. To hear that Chinese workers were denied access to healthcare because of their race made me disappointed, but unfortunately it reminded me a lot of today. There are still racial disparities in healthcare, large ones. This is a problem that persists. As a future healthcare provider, I know the state of our healthcare system going in. Coming out, I want to have made a change in the way people are treated. They should be treated equally, no matter ethnicity or race. And this is such a larger issue than any of us could possibly imagine. It truly is systemic. I, for one, did not know about the Chinese Exclusion Act. A law written in had the effect of killing Chinese plague patients due to the fact that this law somehow allowed racism towards these Chinese workers. This is not the only example, but it is one I will be thinking a lot about. On a lighter note, I am very excited to be able to be in a position to help try and make these changes. And here are my sources. Thank you for listening about the bubonic plague, and I hope you learned as much as I did.